Today, we are diving deep into the thyroid, our body's energy powerhouse. Ever wondered what a thyroidectomy is, or whether you might have only half of it removed or all of it? Stick around because we are unpacking hemithyroidectomy versus total thyroidectomy, what they entail and what are the choices that matter. Let's get started. Now, what is a thyroidectomy? Thyroidectomy is a surgery to remove all or part of the thyroid gland, a butterfly-shaped organ present at the neck and that regulates metabolism, heart rate, temperature and more. It's typically done for several reasons. Thyroid cancers, especially if the risk of spreading, a goiter or something called as a multinodular goiter, severe hyperthyroidism or a overactive thyroid when medications are not enough. Next up, two main types of surgery are done for thyroid gland. One is a hemithyroidectomy, the next one is a total thyroidectomy. Now, what is the difference? Hemi, as the name suggests, is removal of a part of the thyroid, often generally the lobe and the isthmus. Total thyroidectomy is removal of the complete thyroid gland in toto. Now, when is hemithyroidectomy chosen? Suppose there is a benign nodule or an uncertain diagnosis in a particular lobe. So then we go for a hemithyroidectomy. Early stage, low risk thyroid cancers where guidelines now support more of a conservative surgery. When is a total thyroidectomy or total thyroid removal suggested or preferred? When there's a confirmed case of a cancer in both the lobes, or it's an aggressive type of cancer, or there's a large goiter or a multinodular goiter, multiple nodules in each of the thyroid gland, or a Graves' disease needing complete removal, when radioactive iodine treatment is planned afterwards. Now, coming to the pros and cons of hemithyroidectomy. Pros, let's say it's less invasive, shorter recovery, lower risk of complications like the voice nerve or the recurrent laryngeal nerve that gets injured, low chances of parathyroid removal and complications of calcium metabolism. Most patients maintain normal thyroid functions and may avoid daily pill of a thyroid. Now, coming to the cons, removal of the robe requires monitoring. If a cancer is found later on, you may require a second surgery or a completion thyroidectomy at a later stage. Now, coming to total thyroidectomy, what are the pros? Removal of all thyroid tissue, no chance of future disease in the gland. Enables radioactive iodine therapy if needed later on. Now, what are the cons? Lifelong thyroid hormone replacement is a must. It is required and 100% you need to continue to take it. Higher risk of complications like hypoparathyroidism, where removal of the parathyroid gland can happen, and also sometimes nerve damage. Now, coming to meta-analysis highlights, for well differentiated low risk thyroid cancers, hemithyroidectomy and total thyroidectomy shows similar long-term survival and recurrence rates, while hemi carries a fewer complications. What to expect after surgery, recovery and before surgery? Your care team will generally be running imaging like ultrasound, some blood tests, and sometimes a fine needle aspiration or a biopsy may be planned to get an accurate diagnosis. Surgery is generally conducted under general anesthesia. An incision is made on the neck at the lower crease and the surgery is performed. Sometimes endoscopic procedures or transoral thyroidectomy also can be done. After surgery, hospital stay is often a single day or overnight stay. Hemi, generally you get discharged faster. In total thyroidectomy, sometimes a neck drain may be placed and you may have a little prolonged stay. Sometimes recovery includes possible neck soreness, mild hoarseness and fatigue. Usually it is temporary. Scarring fades over months. Sunscreen usage and anti-scar creams can help in reduction of the scar. Now, coming to the post-operative care, hormone testing is useful and guides to how much level of thyroid hormone tablet we need to provide. Normally, hemithyroidectomy, the chances of thyroid replacement therapy is low. For total thyroidectomy, generally we need to continue to provide the thyroid hormone. Now, coming to the rare but important complications of thyroid surgery. Sometimes bleeding that can fill up your neck and lead to difficulty in breathing. That is a common complication. Nerve injuries and low calcium levels. And there you have it. A thyroidectomy might be removing half the gland or the entire gland depending on your condition, your health goals and what does your doctor recommend. Hemithyroidectomy can preserve the function and reduce risk, may need regular follow-up. A total thyroidectomy is definitive but requires lifelong replacement therapy by a thyroid hormone. The good news, outcomes are excellent for most of the patients, especially when guided by modern guidelines and shared decision making. If you found this helpful, hit the like button, subscribe for more clear health explanation, and let me know in your comments what would you like as a next health topic we would like to discuss. Take care and see you in the next video. Thank you.